Dr. Rupali Basu, over to you, ma'am.
Thank you very much. Thank you, the Policy Times, the organizers, who has invited me to talk today. And I'm very sorry that I've not been there physically, because I would have loved to be there physically with all of you and talk. It's very different and very difficult, actually, to do this, hybrid thing. I know that very well. I've been in the healthcare field for last three decades. Probably one of those very, very old hand in hospital and healthcare management when it didn't even start in the year 1990, 1991. And then served about 7 hospitals in heading the hospital operations business, whatever you call it, headed hospitals groups, and in very senior positions as whatever CEOs and MDs, and have acquired a lot of experience in how we are operating currently. I have started telling me that, I have done that, been there. So not really last few years, not really been involved so much in summits, but I have done a lot in my time. So let me say a few things, few pointers, probably. I'm also listening for last few, as Rajkumar was saying. I was also listening to all of you from the first session onwards. See, the research part of the healthcare delivery system, the technology advancements, entire bringing out the lasers and the latest technology in MRIs and CTs, all that doesn't happen that much as yet in our country. It happens all in the Western world still. We look up to USA, UK, Germany, Singapore to make sure that the research happens there. I'm talking of the apex of the pyramid, the tertiary care, the quaternary care, healthcare delivery. And what we do is we adopt those technologies ASAP, and then we also create probably a 6 months, 1 year time lag. We are delivering that care in our country today. A big back, pat on the back. We are being able to do that within that time frame, and I think we are doing it very, very well. So there are hospitals here who are delivering the best possible, best technology, the most advanced care in our country. Similar in that apex, at the tip of the pyramid are the medical college hospitals which are run by the government, like the AIIMS and the PGI Chandigarh, who are also delivering. Now, below that, the care of the hospitals where you have to give secondary care, general, the primary care, and the larger number of reaching out to each individual is what we used to do as the healthcare plans for our country, is where I think has the system and the entire, the scenarios have changed. We have not been really able to do the work which we planned well. Our blueprint was that every 5,000 population, you need to have a sub-center. Every 30,000 population, you have a primary health center, a district, a block, a state, and then you move up so that you reach and your healthcare delivery system is available to every Indian, every individual at their doorstep, whenever they need, whatever they need. That is where I think is now we are being able to do new things, new models, new ways of doing things. And there we are falling short in certain areas. Which are the 2-3 areas we are falling short and should focus on as policymakers is what I'll focus on. One is that we must focus on quality parameters for all healthcare delivery systems. We must do quality, quality work. Why we are being questioned by public, by people, by our peers, by our own people, why we are questioned, that why we are not delivering. And some hospitals do and some don't do. Some nursing homes will deliver good, some don't, is because we don't have standardized methods, standard treatment guidelines, standard, outcome. We are not focusing on outcomes. We are not focusing on processes, standard operating protocols, guidelines, manuals. Every activity of healthcare delivery system can be mapped and that can be standardized for all. So that is where I think is very, very important for us to focus on quality systems for all hospitals. And we are not yet been able to do it. Government, non-government, small, big, private, non-private NGO, every hospital should have the standardized treatment guidelines, standardized protocols, standardized guidelines, etc. I can give you one example. Why did we do so well in COVID? You know why? Because we gave the treatment guidelines was getting done at the top level. And we were, kind of adopting it to not only all hospitals throughout the country adopted to those guidelines, and we delivered good quality care in spite of a disease which was not known to us. We didn't have the the diagnosis, the tools, to diagnose, to treat, to medicines, vaccines. Nothing was available with us, but we got all that and we delivered care. Okay, we did messed up in certain areas, but majorly, I think we have been hailed by the whole world that we delivered good quality care during COVID. So I think the protocol-based care, standard treatment guidelines, clinical pathways are something which should be a must for all healthcare delivery systems. That's one. Two is, I think it's very important to do the referral system. When you have gaps, whatever you can deliver at certain levels is not being delivered to the other levels. And that is what it is. It is a fact that a primary healthcare center will not be able to do a cesarean section, even as simple as surgery as an appendectomy. It may not be possible to do for a sub-center or a block primary health center. So we need to create the referral system, which are the ambulance systems, to diagnose the patient, what is the healthcare delivery system that patient needs, and deliver to the system where it will be delivered. The care will be delivered. That system is, I think, still now by the government and private. It's all kind of, our land of our country is like a land of opportunities, and we are very smart people. So we kind of entrepreneurs will come in every way, every area. But the blueprint, the plan is very vital, because we will be there, but it may not be ideal, or it may not be as per the plan for equitable and affordable care for all. So we have got some gaps in the referral system. We have gaps in our quality of care, and that's how probably we are getting, some amount of criticism from our own people. So we need to be ideal. We need to be, and also I think from the other another point I will mention and then close is the healthcare funding. The majority, 60% of our country's healthcare is being funded by the government. Only 40% is delivered by the private care. So the entrepreneurship from the top, I think we have talked about it in many fora, that GDP, the percentage GDP on health has to go up, and we need more money to be pumped in to the healthcare delivery system. I think that's what is still on, and it is still not done enough. We have not been able to do enough from both central government and state governments. We have to pump in more money into the healthcare delivery system to deliver good quality care for every Indian. So that's what is important. And the last word is that, we need to do for our private healthcare entrepreneurs. I would just give one little suggestion, that go by need-based care. Whatever is needed by the community where you're operating, go by that, not by the surplus-based healthcare. Whatever makes money, heart and cardiology makes money. So let me do a heart hospital is not important. If there is, babies to be looked after, and pediatrics is the area where we need to work on, then we should do that. So the healthcare delivery system has to be focused on our social needs, our needs, and people's needs and communities' needs. So we need to have entrepreneurs more on need-based healthcare rather than surplus or profit-based healthcare. That's what from me today. I'm very happy to be here. I was thinking that I may not be able to deliver in the online system, but I think people have been the attendees have been able to hear me. And thank you again, organizers, for inviting me. Thank you. Over to you. Thank you so much.